Welcome to this edition of the First Aid Show. What we're going to do on this edition is talk about dealing with a patient who has dementia. If you come across a first aid or any medical emergency, you may need to deal with the patient slightly different. So what we're going to do is talk to Glenn Knight. He's from Training to Care. He runs a national training company within the UK, and also he's the licence holder for the Virtual Dementia Tour in the UK. Hi there.
Hiya.
So what we're doing is looking at if someone as a first aider or as a medical professional has to deal with a patient and they suspect this person may have dementia, how would they need to treat this person differently?
Okay, the main problem with someone with dementia is cognitive impairment. So cognitive impairment is where their brain functions are different. Now, someone with dementia, especially things like Lewy body, frontal lobe, Alzheimer's, vascular dementia, will need communication as the key port. They're going to panic, they're going to look at what their injury is, and they're going to look at the environment, and they're going to change in the way that they act compared to someone who's very normal. So where someone with a normal healthy brain will be very compliant, someone with dementia won't be. They'll panic, they'll want to have a lot more space than maybe someone else would. And communication skills are the main thing. What we need to remember with dementia is people with dementia have things like macular degeneration, they have issues with peripheral vision, and they also have problems with neuropathy, so they've lost the sensations in their hands and their feet. And the challenge is that as they panic, they will not know where they are. They're not going to understand what's happening to them. So it's very, very important that we communicate in a slightly different way. We need to slow down the way we speak. We need to use touch as well. Touch is very important. Being tactile with someone with dementia is very important, because then it will make them focus on what you're talking to them about. We need to understand that we may need to ask them a few times exactly what is wrong with them, and may need to monitor them in a slightly different way by just taking our time with them and maybe having to confirm that is right. Most important, obviously, is get the ambulance service there as soon as possible. Communication is the key, though.
So once the ambulance service get there, or even making that phone call, it's important to tell them as well, so that they will be pre-warned about that someone dealing potentially with dementia. Yeah,
it depends where the incident has happened, because obviously in the street we're not going to have a care plan, we're not going to have the bits and pieces that we would in a controlled environment like a care home. So if, say for example, someone had an accident while they were out for a day with one of the members of staff, that could be quite a major problem, because the environment is an unknown environment for them, and then therefore you have your challenges. So you're also going to have people who crowd. Now it's quite important we don't overcrowd these people. They don't know who they are. So someone suffering with dementia will need as much space and as much clear area as possible. We then look in a care home environment, it's slightly different, because we can go and look at the signs, symptoms, what's wrong with them, what medication they have, etc., etc. And obviously there's more people to help. So ambulance first, tell the ambulance that they have dementia. If it's known what type of dementia is diagnosed, then we obviously need to tell them and let them control that. If they know you, make sure you stay with them at all times. So we want you to travel in the ambulance with them.
So if there's a family member there, this family member is going to know what the care they need. As a first aider, you know a completely different set of care that they need. How is the easy way of communicating between the fact that you may need to put a dressing on the person, or you may need to keep them still, yet this person is saying, no, you mustn't do that? Who should you believe? Your first aid skills or what this person's telling you? Or is it a blend of both?
I think ultimately you always look at your first aid skills. Communicating, what you've got to remember with a family member is you need to communicate properly with them, because they will be panicking as well. They will want a certain amount of control, but we need to control the situation. We need to make sure that our knowledge of first aid is paramount. So if someone has a cut on their arm, we've got to make sure that we're positioning them for shock. We've got to make sure that we're controlling that bleed, and we're making sure that that person is being treated that is going to preserve their life until medical emergency services can arrive.
So communicating with the family members is a great thing as well, isn't it? Because maybe we could even tell them to put the dressing on if the person is going to be a bit more comfortable with that.
It totally depends. Obviously, if they're an untrained person who don't know how to put a bandage on, we could waste vital minutes. We need to take control of that situation.
So if you're dealing with a patient with dementia and you're getting a rapport with them and you're working with them nicely, and the crowds, we appreciate that's going to be the big problem. Not so many crowds, but people gathering around. How do you think is the easiest way of getting them to disperse? I mean, could you pick someone and ask others to get them to move out the way? Because with normal first aid, it's a problem, but with this, it could be a real problem.
We need to look at two aspects really. One is the natural thing that people do when there's an incident. People do crowd. It's very similar to a car accident on a road. You'll get people slowing down to have a look at what's happening. That's a challenge. Because obviously you don't know who these people are. So it's maybe asking the family members, just can you give us some space? And maybe being quite strong with these people, maybe saying this person needs space, I'm a carer, I'm a first aider. And obviously if you've got your wallet card as well, that will help because then people know what you're doing. The second part is quite important, that we need to understand with dementia, they will hear various noises. Now these noises are exaggerated by the issues with their brain. So as their brain shrinks, they lose the ability to block out sounds. So obviously if you've got crowds, if you've got people panicking, if you've got an ambulance coming, if it's on the street, we need to be trying to make sure it's as quiet as possible for them, because obviously hearing all of these noises in their head potentially can cause them to panic more.
So with first aid emergency, we're dealing with first aid, but we also might, as first aiders, come across someone with dementia who maybe just appear lost. How would we care for that person? They're not injured, we've got to keep them safe and get them help. So what sort of ideas do we have there?
It's very, very common with dementia that people wander. This is why we have things like deprivation of liberty. DOLS is such an important part because of the fact that that's the care home's ability to be able to make sure that they keep them safe. When you've got someone who's diagnosed with dementia at home, there won't be a deprivation of liberty in place, and potentially you can have people wandering, and there's many facts in the press of people that have left the home, and even one situation where someone was being filmed looking for this person and then they turned up actually in the picture. So what we have to look at is that wandering in a controlled environment is welcomed with dementia. Obviously, if it's putting them in a harm's way, the first thing we need to do is contact the police. We need to get the police involved in this because we don't know who these are, we don't know where they've come from, and what situation they're in. So we need to get the police involved. The police will then take control of that and look to identify that person and get them home.
So we've talked about dementia in different ways there, and the big link back with the other side of what you do is the virtual dementia tour, and I've done it and learnt an awful lot from it. And the real problem with a first aider or any medical professional is getting them to understand what it's like, and if you can understand what it's like. So how are you finding the virtual dementia tour working with first aiders, carers and families to actually understand a little bit more about what dementia is about so that they can give better care?
The virtual dementia tour is specifically designed to improve the standard and the quality of care. One of the things that we need to recognise is that there is no cure for any dementia. And it's one of the top 10 killers in this country. So what we need to do is walk in their shoes. And by walking in their shoes in various situations, we can find ways of being able to help those situations. As an example, as a company, we're very early stages of launching this into the UK. But where we're looking to help and improve things, we're looking at offering courses where we give people the experience of dementia and have them treated under first aid. Maybe with moving positioning, someone wearing all the equipment and actually giving them a dementia experience while they're in a hoist. So we understand exactly where we can help these people. Now the biggest challenge is that we've got to change the way we are. Everything that's happening to those people is perfectly natural to them at that point, but it may be unnatural for us. People sub-vocalise, people make comments, people may swear. We've got to recognise that that is normal for them. The virtual dementia tour is specifically designed to make sure that we can show care staff, families, police forces, ambulances, and give them an experience of what it's like so we can show them the best way of being able to communicate, environment, and all the challenges that come with dementia.
And it's new to the UK, but worldwide there's been a lot of people gone through this programme already, haven't they? So it is proven that it does work.
That's correct. There's over 500,000 people gone through the tour throughout the world. In the UK, we're just starting. So it's so important that we get this training out there. It's new, it's exciting, but most of all, it's going to change the way that people perceive the ageing in this country.
Understanding what's going on in their mind is much easier way. And if I had to deal with somebody, then I've got that picture in my mind, to be a bit more sympathetic and to work a little bit more in their world rather than trying to move them into my world. So I mean, I just recommend anyone within the First Aid Medical does this tour because it's so easy to do, but it's so beneficial. Thank you, Glenn, for coming. You've been giving us really good insight into the virtual dementia tour, and I wish you every success with it.